From CBS 2 News, this is a special report.
Mayor de Blasio is giving an update on the coronavirus outbreak in New York City. Let's listen in.
Where people have had to create a new way of living, a new way of thinking. We've all, here at City Hall, here in the city government, we've tried to give you guidance. We've tried to give you all the information we have to help you through this. But I know for all of you, for every New Yorker, for all of us, it has been a really challenging process trying to figure out our own approach, every single one of us, every single family, our own approach to this crisis, a crisis that nothing like this has happened in a century in this country. And we're all trying our best to find the right way to handle it, to help our families, to help each other, to help our communities, to help protect ourselves. And I think one of the most challenging parts of all this has been that there's so much we all don't know, and it has been very frustrating for all of us to not know more, to wish we could know more, to wish the scientific community, the medical community, anyone anywhere had all the answers, and yet we know that's still not the case. We have learned a lot from fighting this virus right here in New York City. We've learned a lot about what New Yorkers are capable of to support each other and to rise to new heights. We've learned a lot about what works, and we've certainly seen the power of social distancing and shelter in place. But there are so many things we still don't know, and so many things that very personally, very humanly gnaw at us because we don't know, and we want to know. Very immediate questions. Most obvious, I ask it myself, my family asks it, have I already had the coronavirus and I didn't even know it? Have I been exposed to it? All of us are asking this question. Have we somehow contracted this virus already? Have we in some way exposed other people to it? We don't know. And that is the reality of this phase we're in right now, where this disease is widespread, where we have had community transmission now for weeks and weeks. And we haven't had the thing that would really be the difference maker, and that's testing, obviously, on a really broad scale that would help us all to have a lot more answers. That's been the reality we've been living through the months of March and April. It's not an acceptable reality for any of us. It's been what we've had to make sense of somehow. And again, I credit all of you. You've found the best way you could to deal with a situation where there's just not enough answers. But I want to remind us all, I want everyone to take hope from the notion it does not have to be this way. It does not have to be this way going forward. We can change this situation. We can actually provide a lot more answers if we get the help we need to do it. And then we use the extraordinary capacity and ingenuity of New Yorkers to follow through. When we have that testing, a whole world of possibilities is going to open up. We're going to be able to give people a lot more answers. And it's going to help us not only to have more comfort knowing that we know a lot more about what we've experienced, what our families experienced, it's going to give us more power to push on to the next phase, to push back this disease and make things better for all of us. We need to be able to envision that next phase, that new reality where things really do start to get better. And it's someplace that will take real work, obviously. But we can get there. We will get there. My promise to you is that I will keep pushing us forward. I will do everything in my power. This entire city government will do everything in our power to get us out of this phase we're in and on to something better as quickly as possible. We need to do the work now to be able to make that next big jump. So today I'm going to give you an update on the testing, the approach to testing, the approach to tracing, the contacts, all of the things that will take us to that next level. Today I'm going to give you the shape of what it's going to look like. Broad strokes, but enough for you to start understanding and feeling the way forward. And I remind you that we talked a few days ago about those phases of this disease. And I'm going to go over those again for a moment. Right now, we're in the widespread transmission phase. This is not a place we're going to stay. Obviously, we can't accept this reality. We're going to fight our way out of it. The next phase is called low-level transmission. Now, to get to low-level transmission and to hold on to it, you need a huge amount of testing. Not just tens of thousands of tests per day, as many as hundreds of thousands of tests per day for a city of 8.6 million people. But when you have that kind of testing, when you have it available whenever it's needed for whoever needs it, then you're also able to do a lot of the other things that continue to contract this disease and make sure that people are protected. So when you find that someone has tested positive, you're in a position to isolate them, to quarantine them, to trace all the people that they came in contact with who might have gotten the disease from them, the people they came in close contact with, and then help all those people as well. So we have to be ready to push into that phase, that low-level transmission phase that we all want to get to. We have to have all the building blocks in place. Even while we're fighting to get the testing we need, we have to have the building blocks in place, and that's what we're announcing today. So the plan is called Test and Trace, and it's a very straightforward concept. It's what you have deserved all along. Had there been the testing from day one, this is what we could have done so much more of in the very beginning to contain this disease, but now this is how we ultimately defeat this disease. You need to be protected every day. You deserve that as a New Yorker. You need to be protected. You need to know help is there for you. You need to feel that sense of protection. Testing is going to allow us to do that. And you need that test to be easy to get. So it has to be plentiful, and then it's our job to make it available in communities all over the city in lots of different ways, so it's easy for people to access. We're not there yet, but we're going to show you how we get there, pending being able, of course, to get the help we still need from the federal government to get that vast amount of testing, or somehow to find it in the international market, which to date has been extremely difficult, but we're going to keep looking under every stone to get the quantity of testing we need. So the testing will be the key, but I want to give you the sense of the whole plan, because you deserve that too. You need to know, you deserve to know, if something happens to you, what is going to be the reality of how we'll help all the people in your life? How is it going to affect the rest of your family? What kind of support are they going to get? Or the people that you come in contact with, your friends, your neighbors, your coworkers, whatever it is, we're going to lay this out to you. Now, even though we don't have the testing that we need today, we're going to keep fighting for it, and we want all the other building blocks to be in place more and more each day. So as the testing comes in, we can plug it in and get all these pieces working together. So we have made some progress on testing, as I announced a few days ago. We found one company in the entire world, one company, that is providing us now a steady supply of test kits. It's not a huge amount, but it's really helpful. And in the beginning of May, we'll be creating our own, manufacturing our own here in New York City. Huge breakthrough. It's going to help a lot. Every additional test we get helps someone to be safe. But we want to find a way to expand that production as much as we can locally while finding every other source around the world, and especially getting that federal help we need. And that demand has to continue every day, because the one place that could really create the breakthrough is the federal government. They still haven't done it. So we will then need, once we have more and more tests, more and more sites to do the testing. And we're identifying public sites, public buildings all over the city that will be turned into those test sites. And they'll be ready to be turned on very quickly. So we do believe, because we're seeing progress from everything all of you are doing, the social distancing, the shelter in place, everything you're doing is making a difference. We believe every day it's getting us closer to the point where having that testing, having the ability to follow through in each case becomes more and more possible, because as the numbers are driven down, then the notion of literally tracing each and every case through, knowing everyone the individual came in contact with closely and helping all those people. Every day the number of cases declines, that possibility of doing that really completely becomes greater. But we also know we're not there yet in terms of our overall indicators, what we show you every day. We'll talk about them again in a few minutes. We still have work to do, but we definitely see progress, and that makes this plan all the more necessary. Now, two concepts here, as I said, test and trace. So testing, widely available. Here's how the plan would go. It's widely available, plenty of sites, plenty of tests. So what happens to you if you go to a test site? Well, if you test negative, that's great. And of course, you'll get instructions about how to continue to protect yourself, because even a negative test doesn't mean you're out of the woods forever. It means, thank God, that day you don't have the coronavirus. And we'll remind you of all the things to do to continue the smart precautions to protect yourself, your family, and help drive this disease back. But if you test positive, then we get you care right away. If you can't isolate properly at home, and that's a lot of New Yorkers that just don't have the right space in their homes and their apartments. If you can't isolate at home properly, we'll get you a hotel room. We'll get you the help you need. The whole idea is to help you to isolate, to get well, to have the support you need, and of course, get tested again to know when you're done with the disease so you can go back to your regular life. Making sure that that is available, that support is available for each and every New Yorker who needs it. That's what this plan is all about, and that's the building blocks we're putting in place now. The hotel rooms and all the support that goes with it. Now, the tracing is literally hunting down each and every case, every individual who contracts this disease, following up with them and making sure that they're interviewed about the people in their life they've been in close contact with in the previous days, and then following up with those people. And it's the same thing, just continue following it all the way through. If you were in close contact with your cousin, then we're going to go see your cousin. We want your cousin to get tested. Then we want to see if your cousin tests positive. Who were they in close contact with? And just keep following it through every single time to make sure that everyone who needs that test gets it, everyone who then, because they get a positive, needs care, gets it. Imagine it just happening over and over again, and that's how we constrict this disease. We obviously help people, most importantly, help people to know what's going on with their own body, their own health, and get them the help they need to get well. Job one. But it's also how we just drive the disease back day after day. We have to keep doing it. It's very repetitive if you think about it. We have to keep doing it to the point where, in a perfect world, we literally can see every single person in the city who has the coronavirus at that time, and we know exactly where they are and exactly the help they're getting. That's where we have to go to the maximum extent humanly possible. Now, the kind of care that you will need, let's go through an example if you do test positive. Here's a real scenario. Well, we want to take care of you. As I said, job one, take care of you. Get you the care you need. Get you the isolation, the quarantine you need. So you want to know the second you get a positive test, what do I do next? Where am I going to get medical care? How am I going to make sure I get better? How am I going to make sure my family isn't infected because I have the disease? That's what we work with immediately. We get you to, if you don't have, again, a place you can isolate properly at home, we get you to a hotel. We put that care in place and that support in place. Then that interview immediately, who have you been in close contact with in recent days? And each and every one of us would say, okay, well, I was either around my family members, my friends, someone I worked with, someone who's a neighbor. Go through that whole list. Go and then literally follow up with each and every one of those people. Get them tested. Anyone who's negative, great. We still will give them the information to help them take care of themselves. But if anyone's positive, if your friend, for example, who you just spent time with the day before is positive, then we get your friend to the care they need, to the isolation they need, and the support. And we take and interview that friend and go through those contracts. over and over and over again. It's going to take thousands and thousands of people to do this right. And we're putting that team together now. When you think about what it is to put this whole apparatus together, we're going to need tests, and that means the test kits. It means the personnel to give the tests. It means the PPEs to protect those personnel. It means the locations to give the tests in. It means the labs to process the tests. We need the personnel to do all that contact tracing. We need the hotel rooms for isolation, and then all the services to protect people and give them support while they're in those hotel rooms. That entire apparatus is being put together, and obviously, a city this size, we could be talking about thousands of people in isolation at a given point, tens of thousands. We don't know the number yet, but we do know that we're going to build an apparatus that will keep expanding to accommodate whatever that true number is, because it's the only way we protect people and it's the only way we drive this disease back. So if you're someone who tests positive, and now let's say you're in that hotel, what do you need? Well, we have to get you to the hotel, so we'll provide that transportation, of course. You need the place where you can stay. We have a lot of hotel rooms, and again, it's very sad what's happened to everyone who works in the hotel industry, not having jobs. Everyone's gone through a lot, but there clearly are a lot of rooms available to us. So we have those. We would have to provide food, and we're obviously in the middle of a huge food effort for the whole city, so we can use that same effort here. We have to provide laundry services, just the basics. Obviously, we have to provide health care, and that's something we will do for anyone who's in those isolation settings, making sure they're safe, making sure they're well, checking on them frequently. And again, every day we drive back the disease, we have more and more people, more and more healthcare workers who can be turned to other crucial tasks like this instead of just having to focus on the front lines in our hospitals. So again, it kind of all fits together. The more you reduce the disease, the more healthcare personnel you free up to focus on the isolation sites and driving back the disease. And then, of course, telemedicine. We're going to use technology clearly in many different forms to help update people, stay in touch with them, but also direct connection to a human being, to a medical, to a doctor or a clinician who you can talk to, who will check in with you, who will answer your questions. So we want a lot of contact with folks who are in isolation. We want to make sure they're well, and if they need anything, they can get it quick. So if you said, can we do all that this very day? No, all those pieces are not in place today, but they will be in place next month. And as we fight to get all of the testing we need, we're going to be building this apparatus every single day. And again, we don't know the exact number yet of people it will be serving. Absolutely, it's going to start in the thousands. I'm not going to be shocked at all if it goes into the tens of thousands. But we will build an apparatus that can grow with the need. So as soon as we can start to do those tests in a truly widespread manner, we can start to accommodate people in this fashion as part of that effort to get to low-level transmission. And that's going to be an intense fight. I want to be clear. I think as you're hearing all these pieces, it's a lot to orchestrate. It's a massive operation. We will put it together. We'll make it work. But it also means finding everyone and making sure that we communicate with all New Yorkers and make them really understand how easy it will be eventually to get testing and encourage them to come and get it, because we have to know if someone has the disease to do all that tracing and all that follow-up and all that isolation. If there are people out there who never get tested and might have the disease, and we hope and pray a mild version of it, remember, then they're still spreading it to other people. So this is a big, big job, and it comes with a certain amount of unknowns, obviously. But what will be crucial as we build it is to communicate to all New Yorkers how important it will then be to engage it constantly. There will be a big outreach effort. There'll be call centers with people constantly communicating with anyone who's trying to get information. There will be a lot more healthcare workers, as I said, moved into these kind of tasks, testing people, taking care of them in isolation. We're going to expand that pool of disease detectives that we talked about back in the early part of March, who do amazing work through our health department. But we're going to add a whole lot more folks who don't necessarily have that high level of training that our health department disease detectives have, but they're going to be trained to do the basics, and that's going to take thousands of people. And again, we have a lot of city government employees who right now, some of them could be put into this work because their regular work is not happening. We have a lot of people who work for nonprofit organizations who contract with the city. Some of them can be transferred into this kind of work. If we need to hire more, of course we will, because this will be absolutely crucial to our success. And we're going to use all of these efforts to collect the kind of data that will allow us to know exactly what's happening with this disease and how we keep fighting it back. So we'll have a team that puts together that data, analyzes it, helps understand the strategic meaning so we can act on it quickly. A lot to do, but it's a vision that makes sense. You can hear how all the pieces fit together to protect New Yorkers and move us forward. I'm absolutely confident that we can put this together. The missing link is the testing. I have no doubt about New York City's ability. I talked yesterday about the self-sufficiency that we are going to exhibit as New Yorkers. We've learned a very powerful lesson in self-sufficiency too often during this crisis. Too often we've been left on our own to fend for ourselves, but New Yorkers have been absolutely brilliant at fighting back. We will set up this entire apparatus. No one's giving us a playbook or coming here to do it for us. We will create this. But where we absolutely must have help is that testing. If we don't get the quantities, then all the other pieces don't come together. Now, that is the vision that we will be implementing over these next few weeks. It'll be growing throughout May, and it's how we will get to that kind of transcendent place where we get out of widespread transmission into low-level transmission. I can't give you the exact day that we'll get to low-level transmission. I can tell you it's very much a function of how much testing we have and how many New Yorkers we reach, and making sure that everyone gets tested, everyone is reached and is communicated with, that we don't miss people to the maximum extent possible. That's going to tell us a lot about how long it's going to take to get to low-level transmission. And then, remember, we want to get through that phase and on to the even better phase where there's effectively no more cases. So I can't give you the exact timeline, but I can tell you we're going to build a very aggressive effort to get through it as speedily as humanly possible. And all New Yorkers, once again, are going to have to be part of it. Just like you fought back the disease with everything you're doing in your own life, we're going to need you to fight it back by being a part of this effort, by communicating, by participating, and we'll have a lot more to say about that as it builds out. Now, in the meantime, we've got a lot of work to do, even with the tools we have right now, because we know where some of the hardest hit areas are. And I want to emphasize, the right thing to do is to go where the need is greatest, where people are suffering the most, where we've seen this disease take hold the strongest, and it's all connected to those healthcare disparities we've talked about before. It's deeply unfair, and it's quite clear what's happening here, that this disease is hitting hardest where people have had the least income, the least healthcare available to them. We need to go there and help people more because it's the morally right thing to do. It's also crucial to any strategy to drive back this disease overall, to go where it's having the biggest impact and cut it off in every way we can. So even with the imperfections of the amount of testing we have now, we're still going to devote more testing as we get it in to focusing on the hardest hit areas. One of the groups of New Yorkers who we're most concerned about right now, who are bearing a lot of the brunt and have borne the brunt even before this crisis, is our public housing residents, the 400,000 New Yorkers who live in NYCHA buildings. Now, I want to say I've spent a lot of time with NYCHA residents. I've spent a lot of time in those buildings over the years. These are folks who are the backbone of our city, who work so hard and fight through such tough odds all the time. NYCHA for decades did not get the support it deserved. A lot of people are living in buildings that haven't gotten the kind of support and maintenance they deserve, in the sense of, you know, a building 50 years old, 60 years old that should have been rehabbed decades ago. Never got that. And so a lot of people are living in really tough circumstances. And obviously these are among the lowest income New Yorkers on top of that. So folks who often haven't gotten a fair shake and didn't have access to the health care they deserved over the years. But these are folks who are the backbone of the city, and we owe it to them to make a special effort. Now that we finally are getting some testing in and building some of our own, this is going to be a real focal point. Everyone in New York City has been hit hard by this pandemic, everyone. But the residents of NYCHA have been hit particularly hard. And we want to do a lot more to reach you, to help you, to bring you support, not just the testing, but other forms of support to help you through this crisis. So folks in NYCHA have experienced these healthcare disparities. A lot of folks in NYCHA also have the additional challenge, again, not having had really serious conditions treated sufficiently, whether it's diabetes or severe asthma or heart disease. So we're talking about a lot of people who have those pre-existing conditions. They're vulnerable, especially the many, many seniors who live in NYCHA. We're going to provide new support. So first of all, the testing that we have up and running already, the 5 community sites through health and hospitals, we obviously know they are in many cases very close to NYCHA developments. That's an important option for folks in NYCHA who are older, who have those pre-existing conditions. We want to make sure you're getting tested. So those sites are up and running now. We're going to add 6 more sites in the next few days. And NYCHA residents will be a priority at all 6 of these new sites. And we're going to, obviously, with the leadership of NYCHA, with all the people who work there, we're going to spread this word to all 400,000 residents. But these new 6 sites are near NYCHA developments and are going to be prioritized so that NYCHA residents can get tests there. So opening on Friday, at Health and Hospitals community sites. So Health and Hospitals will run these community testing sites. Opening Friday, 3 sites at the Cumberland Health Center in Crown Heights in Brooklyn, at the Belvis Health Center in Mott Haven in the Bronx, and Gouverneur Health Center in the Lower East Side here in Manhattan. Then opening next week, 3 additional sites that will actually be at NYCHA locations, in NYCHA complexes, at the Jonathan Williams houses in Williamsburg, at the Woodside houses in Woodside, Queens, and at the St. Nicholas houses in Harlem. Testing, we're going to keep expanding, again, focusing first on where the need is greatest, and these 6 new sites will be a crucial part of that. Second, we've got to make sure that NYCHA residents get more and more support in terms of the supplies to keep them safe and keep everyone around them safe. So we're going to keep delivering supplies as they are needed, and that starts with face coverings and gloves for all NYCHA residents. Those will go out next week, delivered across all of the housing authorities, so literally every building, every resident. It will help people to stay safe. It will help them to protect others. We're also going to be giving out hand sanitizer to seniors in particular. So that'll be the priority, to make sure all seniors have the hand sanitizer they need. And as we get more supplies, we'll go beyond that. Third, we're going to focus on the reality of hunger in public housing. I've been talking about this for weeks. Everyone in the city is dealing with this challenge more and more. Hundreds of thousands of people have lost their jobs. Everyone who doesn't have a paycheck and doesn't have a way to pay for food needs help. We will be there for all New Yorkers. No New Yorker will go hungry. That is the pledge. We've talked about all the ways that people can get help, obviously by going to 311 or nyc.gov/getfood. We're going to do a special effort around NYCHA buildings and senior buildings in particular as the focus. So obviously, NYCHA residents, like anybody else who have been hungry in these last weeks, have been able to go on to 311 or go online to get help. We're going to do something different now with the senior buildings, the buildings in NYCHA that are explicitly for seniors, have high levels of concentrations of seniors, we're going to just provide the meals directly, meaning instead of anyone even having to call and apply, we're going to go right to their door, right to your door, and bring you meals directly. So we'll have enough meals for a whole building of seniors and get them right to them. We don't want anyone to miss out on the food they need, so we're going to do this proactively. Now, another crucial piece, the fourth element of this plan, is to recognize that there's still so many people in the city, understandably, they're not only vulnerable, they don't have all the information they need, they don't know where to turn. This is particularly true with folks who are dealing with serious healthcare conditions, folks who are disabled, seniors, folks who do not speak English as a first language. There's a lot of folks who are particularly vulnerable and don't know where they're going to get the help they need. We want to go right to them. So we'll be calling through seniors in NYCHA and other vulnerable residents directly. Live calls, folks calling to get them the help they need, if they need food, if they need supplies, whatever it happens to be. Obviously, if they need medical care, connect them right away to a clinician. We're going to do that as a proactive approach as well. And then finally, we know of so many seniors, in particular senior citizens, who are feeling more isolated than ever. Obviously, one of the most painful realities of this crisis, there are so many, but one of the most painful human realities has been grandparents who can't see their grandchildren or their children, seniors who used to get visits of one kind and another that kept their spirits up and got them help they needed. A lot of them feel particularly isolated right now. We want to make it a little bit easier, and one of the ways, of course, is through technology. So there are so many seniors in public housing who don't have access to technology. We're going to do something about that now. We're going to make a $5 million investment to give free tablets with internet service to 10,000 NYCHA seniors who are particularly isolated and need that support so they can stay in touch with their family and their loved ones and have more access to the help they need. We'll start in locations in Brownsville, in East New York, in Mott Haven, Red Hook, Bushwick, and Coney Island. There'll be a phone helpline if the seniors need any help working with the tablets or figuring out how to get the information they need. There'll be live phone helpline for them. And I want to thank, I'm often giving thanks these days for all the people who stepped up. I want to thank the folks at T-Mobile who are partnering with us on this project to help these seniors get more connected and get the support they need. So, a couple more things today. One, a question that came up yesterday, and I appreciate that the question was raised because I had made the announcements, and they were no fun, obviously, the announcements that the May and June events had to be canceled in the city, the festivals, the concerts, the parades, that we had to cancel them. But then the question came up yesterday about the 4th of July. And, you know, I thought immediately about the big gathering like we're used to, you know, millions of people coming out and all. I thought, well, how are we going to do that by the 4th of July? But then I started thinking, wait a minute, there's no day like the 4th of July. It's special, and even if we have to do something different, we have to mark it in a very meaningful way, especially at this moment where everyone's fighting shoulder to shoulder to get through this disease. So I reached out to the CEO of Macy's, Jeff Gannett. And he has been a fantastic partner, as has everyone at Macy's with this city. We feel a very special connection to Macy's in this city, obviously because of the fireworks in particular, because of the Thanksgiving parade. But they've been just very, very civically minded for decades and decades. So I said to Jeff, look, we may not be able to do it the way we historically have, but I want to know how you feel about this because we think it would be right. I think it would be right to mark the day in some special way, whatever the circumstance. And to the credit of Jeff and everyone at Macy's, he said, we are right there with you. We want to do that too. We're ready to do it. So one way or another, the show will go on. One way or another, we're going to celebrate the 4th of July in a very special way in New York City. There's definitely going to be fireworks. How we do them, where we do them, how we do it in a way that's safe and keeps New Yorkers healthy, a lot of questions that we have to answer between now and then. Thank God we know that fireworks can be seen by New Yorkers all over the city, even just looking out the window or from the fire escape from the roof. But we have to do it in a way that's safe and smart. We all going to have to, I think, for quite a while, recognize social distancing. But this is a day we cannot miss. This is a celebration that has to happen because it's about our nation, and it's about all we stand for as Americans and New Yorkers. And it's a symbol of our strength and resilience. But we're going to do it the smart way, and we'll have a lot more to say on that as we get closer. But a profound thanks to everyone at Macy's. No one would have blamed them if they said, hey, we just can't do it this year. But their spirit was, you know, come hell or high water, we're going to find a way to do this and do it the right way and do it the safe way. So thank you to everyone at Macy's. Now, let me, as I start to conclude, go over the numbers we watch every single day. And this really always will tell us how we're doing and what we have to plan on going forward. Again, I've been very honest with folks. These numbers tell us a truth. It's not always the truth we want to hear, but it's the truth we need to be able to make the right decisions. And it reminds us to stick to our plan. Even against the backdrop where there's been real progress, we still need more progress to get to the point where we can get to low-level transmission and loosen up some of those restrictions. So for the daily number of people admitted to hospitals for suspected COVID-19, unfortunately, that number went up from 204 to 252. Daily number of people in ICUs across our health and hospitals for suspected COVID-19. That number went down. Good news, from 857 to 821. The number of people tested positive citywide went down from 35% to 33%. The number of people testing positive in the public health lab tests went down from 63% to 54%. So 3 out of 4 indicators absolutely in the right direction. One more wasn't so good today, but overall, real progress. Let's stick to it. So, look, before I talk to you, just to give you a few words in Spanish, and then we'll hear from our colleagues in the media. The bottom line here is to always be building the next phase, always be building the next step forward. We have proven in this city, all of us, that we can protect and support each other. Now we're going to build something, in some ways, even bigger. We had to fight every step of the way through the last few days. Now we're going to build something to fight back, to take on this disease and push it back. This is nothing never been done in this city before, let's be clear. An operation that could reach potentially hundreds of thousands of New Yorkers in a single day and have thousands or tens of thousands of people in isolation with all the support they need and constant tracing of everybody who might have been exposed to this disease. Nothing like this has ever been seen before in the history of the city. But we will create it, and we will make it work, because that's what New Yorkers do. And it will be part of our story of how we fought back this disease and we won the day. So a lot to do, but we'll do it together, and I have no doubt that we will prevail. Just a few words in Spanish.
You've been listening to Mayor de Blasio give an update on the coronavirus outbreak in New York City. We're now returning to regular programming here on CBS 2. For extended local coverage, stick with our streaming service, CBSN New York.
This has been a special report from CBS 2 News. We now return to our regular programming.